Hi, I'm Dr. Yong Ren from BJIOS Orthopaedics at Farrer Park Medical Center, and I'm a consultant orthopedic surgeon. Elderly are predisposed to falls for a number of reasons. Firstly, as we age, we lose functional reserve in our muscles, bones, and this results in an inability to deal with accidental falls. In addition, visual impairment and decreased cognitive faculties will lead to decreased perception of the world around us, resulting in a high incidence of falls. Falls can hence lead to injuries because of poorer bone mass in the elderly, and this frequently results in one of various forms of osteoporotic injuries. Falls in the elderly can result in injuries to a variety of body parts. Firstly, a fall on the outstretched hand can result in distal radius fractures. Falls on the arm can result in proximal humerus or shoulder fractures. Falls on the buttocks can result in spine fracture, pelvic fractures, and hip fractures. Of these, hip fractures constitute a major problem in the aging population of Singapore. Hip fractures in the elderly are almost certainly treated with surgery because conservative means result in prolonged bed rest and complications such as deep vein thrombosis, urinary tract infections, lung infections, and bed sores. Surgery for hip fracture can range from fixation of the fractured bone to replacement of the hip joint, which can be partial or total. Recovery from hip fracture surgery would require weeks to months of post-operative rehabilitation and exercise. About 70% of patients can expect to return to a similar level of function after hip fracture surgery. An important determinant of outcome would be early hip fracture surgery. Here in BJIOS Orthopaedics, we have a full complement of orthopedic specialties to deal with all the injuries sustained by the elderly. We have surgeons specializing in wrist, shoulder, spine, and hip surgery to help heal the injuries sustained by our elderly in falls. We also have comprehensive facilities within our center itself, including our own day surgery for minor fractures, our own imaging facilities for X-rays and other scans, and our own physiotherapy services for post-operative or post-injury rehabilitation of our patients. Injuries resulting from falls in the elderly should be evaluated early. Our team at BJIOS Orthopaedics is here to help.